Does fat hurt? Well, yes, it does. It's not that eating fat or even poking your fat causes pain. It's that the presence of fat causes other body parts to hurt. But it's not quite that simple. There's some fat that you want to get rid of that is more important for relieving pain. So let's dive into this bowl of fat and learn what to do about it. It starts with knowing the types of fat. The most common categories for body fat are subcutaneous and visceral. Sub means below and cutaneous means skin. So subcutaneous means the fat just below the skin. Remember the old "can you pinch an inch" commercials, right? So when you pinch a glob of skin around your belly or on your thigh, that is subcutaneous fat. Now, visceral fat, often equated with abdominal fat, is the fat around the organs. Most of the viscera, the organs, are within the abdominal cavity. So this visceral or abdominal fat is fat deep inside the abdominal area. Okay, here's a quiz. Which do you think is more likely to contribute to chronic pain in the body? Subcutaneous or visceral fat? How'd you know? Good job. It's visceral fat. So join us for our twice-a-year cleanse detox, where we can help get your body healthy from the inside out and remove some of that visceral fat. So give us a call, or we'll let you know how to sign up for the 10 or 28-day cleanse, right? On our website or in our office. So is it possible to look skinny and have painful fat? Yes, it is. A fancier way to ask this is, does visceral abdominal fat or subcutaneous skin fat promote inflammation and pain more? Well, visceral fat seems to be the bigger culprit. So this is the fat around your abdominal center area. So it's more interactive with the immune system. Visceral fat is more like an organ with a life and mind of its own. That's kind of sketchy sounding, but it's true, and it is sketchy. It does some bad stuff. Visceral fat secretes pro-inflammatory chemicals like interleukin-6 and TNF-alpha, called tumor necrosis factor alpha. These are known culprits in the crimes of promoting inflammation and chronic pain. So one interesting finding from recent research is that visceral fat on women seems more likely to promote pain than visceral fat on men. That's not fair, but it seems to be the case. Of course, this can be partly related to hormonal differences, especially estrogen levels, because everything's intertwined in our body's physiology. So what's our takeaway? Don't be fat, right? Well, yes, but even skinny fat can be bad, and it may be worse than surface-looking fat. So true healthy habits will promote lower visceral fat and less pain. So don't just look at the scale. Be healthy from deep within. If you want to get rid of pain and inflammation, is it better to cut the sweets, or is it better to get rid of that visceral fat? Well, sweets will raise your blood sugar, which then causes an insulin spike. And then the sugar in your bloodstream is intaken by those small nerves and blood vessels, and they just continuously gorge themselves on blood sugar until the blood sugar levels drop back to normal. So we also know that high insulin causes inflammation chemicals to rise. So that clearly is not healthy to have lots of sweets. But then we also know that abdominal fat, also called visceral fat, creates more problems. So it increases inflammation markers, and whether from sugar and insulin or from visceral fat, we know as inflammatory markers such as C-reactive protein and interleukin-6, as they go up, nerve damage goes up and peripheral neuropathy goes up, even in people who are not diabetic. Okay, so that's bad too. I really recommend against both indulging in lots of sweets and having lots of visceral fat. But the research was done and the results are in. The visceral fat is worse because even after people got their blood sugar under control, those with visceral fat continue to produce inflammation. All right, so you can call us about getting rid of visceral fat through a healthy cleanse. We have a 28-day and a 10-day cleanse that are super good, changing your diet for a short time and then hopefully for a long time so that you regulate your blood sugar and reduce that abdominal fat. Have a wonderful day, and may God bless you.